Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C. Hi, welcome to Filibusters in Fine Print, where we have all the news that's fit to print, which I do believe we have stolen from someone. So I'm super afraid about
it's
copyright.
A newspaper from,
yes.
I learned that in journalism school 20, well, it doesn't matter how long ago.
It doesn't matter. You know what? We are a podcast, but we do want to acknowledge that newspapers should still exist.
I still get hard copies delivered daily, but again, journalism school.
only on special occasions, but I feel like I need to venture out to a bookstore and buy a newspaper and fill it in my hands.
Oh, okay. With that like banner headline?
Yes,
or what
exactly.
Yeah.
Because I might want to save it, even though it's sitting in my closet rotting away. I don't think is necessarily what was supposed to be the goal of that.
Probably not.
Yeah, I know I have all of my Obama ones.
Oh, there you go.
Yes.
There you go.
Yeah.
Yeah, I found all my high school newspapers, part of a renovation project.
Wow.
It was a blast from the past.
I feel my parents, though, like right now in Brunswick, Georgia, like shivering because they are so big on fire hazards.
Oh, no. Oh, no.
So I hear them going, throw it away. Just let it go.
Yeah. Let it go. You don't need all this paper or accelerant around the house.
No, not around the house. By the way, my parents, this is your daughter, Lauren Ladney, Director of Government Relations at AMGA, and I'm with...
Hi, everybody. Darryl Drevna, Senior Director of Regulatory Affairs.
This will force them to listen, I think.
Yeah, no, it's got to be friends and family, right?
It's got to be friends and family.
Get that baked into our statistics here.
Yes, and our friends and family in the public policy department, they're not here with us. It's just us.
Just the two of us again.
Yeah.
So, so I guess it's on us to have the fun question of the week or what have you.
Yes.
So I know how much you love pop culture.
I do.
Give me something that made you irrationally angry from pop culture that wasn't really fair.
Oh, wow. There's so many things. I will gripe about Netflix because I am always so sad because so many shows on Netflix, some really great shows, do not survive to have a second or third season. And particularly, I think about the really fantastic show Glow, which is about these female wrestlers from the 80s. And it was like their WWF. And it went for 3 glorious seasons, did not get a 4th. The directors, they also created the Babysitters Club, which is, as an 80s baby, also big. That lasted 2 seasons. And there's just so many other shows that do not get long lives on Netflix. And so that makes me irrationally angry because, like, we don't know who's watching it. We have no idea how many hours people watch things. There's no transparency.
No transparency?
Yes.
I wonder if I guess we just had a UFC cage match on the White House lawn. I wonder if that would, like, bring back Glow. Like,
maybe.
This is a thing, you know?
I know, but it's on Paramount Plus, so how many people got to watch it in order to, like, actually push what we need on that? But that makes me irrationally angry because there's so many, I love television shows. There's so many really great ones and so many great actors. And I just want everyone to continue to write and, like, be paid because we know what the AI revolution might look like, and creativity is always something that comes from within. It does not come from a machine.
Gotcha.
Yeah. What about you?
So I have an issue with Sir Paul McCartney. So
What? Wow.
So he had a song with Live and Let Die,
Okay.
right? And then one day he had a request that he denied from Weird Al to do a version called Chicken Pot Pie.
Oh my
which,
gosh.
like,
That
there's a
sounds amazing.
world out there in an alternate universe, an alternate timeline. That song is out there, and every so often I wake up is like, what would the lyrics be? I have to know. I have to know.
See, I'm really shocked by this because we've had the conversation. I am not a Beatles person. I love the Beach Boys more than the Beatles.
Okay.
And so for you to have beef with Sir Paul McCartney, shocking to me.
Beef is the word because he denied it because he's a vegetarian.
Oh.
And didn't want to...
I was not expecting that.
And he didn't want to promote, which is his prerogative. I have no issue with that, but...
That is.
Yeah.
I was not expecting... I didn't know I was walking into that either.
Yeah. So there you go.
Look
That's
at that.
my irrational thing. So we should probably talk about CMMI now.
We should probably talk
'cause
about
they're
CMMI.
Rational issues. with
Yeah, there are
government.
some things that are coming out of CMMI. Wiser model, one of them.
Wiser model,
Bringing
yeah.
a lot of irrational, I think that's rational anger.
Yeah.
From you, from AMGA members. But I was really excited because this is a conversation that happened a couple of weeks ago where Abe Sutton, who heads up CMMI, spoke to AMGA board members. And I immediately came up with Willing and Able.
Willing and Able.
Yes, as the title. I mean, like, it's there. It's
I think
permanent.
we're going to go with that
Yeah.
when we write up the blurb for this episode.
Exactly. So we've been talking about Abe Sutton for quite a while. I think we've particularly been talking about Abe Sutton this year. I know you and our colleague who's not here with us today, Jamie, have gone to several conferences, several events where he has spoken. So for him to speak to the board seems like a culmination of a lot of interactions that you two have had this year.
No, we've sort of been quietly stalking him around DC, and then I actually got to meet him, and it was everything you would hope it would be.
Okay, that's great.
It was great. No, he was really, really friendly, really great to meet with, and I think to his credit, is really willing to get out and about amongst the people, so to speak, and talk to folks in the healthcare industry, whether it's the payer community, the provider community. He sat down with our board of directors for a little bit more than an hour, which for a public figure or a government official in his position is a really heavy lift to clear his schedule and meet with us. So we're really appreciative of that. But having seen him speak, at other events and then with our board of directors, he's certainly hitting on some key themes.
Yeah, and he's also very young, right? Is he in his 30s?
I think so.
Wow.
Everyone looks young to me. When
I guess I've gotten to that point in age too.
Yeah, it's like when I have my readers on, like, oh, okay, I have to look over them now to see like how old are you?
The Chuck Schumer.
Exactly. Yeah, that's just what I want.
So he's bringing a youthful energy to CMMI.
I think so.
Yeah.
And he's, if you listen to him speak, whether it's with our board of directors or around town, they are seriously concerned about what Medicare is spending just, in general, where it's being spent, how it's being spent, and they are looking at what policy levers, what policy buttons can we either push, pull, what have you, to clamp down on costs and make sure that Medicare is getting the most for its increasingly scarce dollars, right? So I think that is really what CMMI is attempting to do, and they're trying to do it in some fairly creative ways within the confines of their statutory sort of restrictions.
Or sometimes out of the confines.
It's out of the confines, yeah, exactly. So, yeah.
So it seems like they've been focused on a new strategic framework, and it's 3 pillars. We like pillars in healthcare.
We do, yes.
Yeah, we have 6 pillars with MACRA for us.
Yes.
He has reduced it because he's in the government and he believes in efficiency. To three pillars.
Yeah, we could probably fit ours into these if we had to.
If we had to, but let's keep it at 6 right now. So it's focused on prevention, patient empowerment, and competition. How do you see these things actually translating into an actual model design?
I think that all 3 of those are going to lead into cost containment, right? We're going to prevent things, and this fits into the White House's and Secretary Kennedy's "Make America Healthy Again," and that's under that rubric. We're going to prevent chronic disease by, better fruits and vegetables and exercise and that sort of thing. So, there are some ideas that can come out of CMMI, like, is it, using technology to track wearables and that sort of thing? Or are we going to have a model that gets into, GLP-1s and weight loss and that sort of thing? So, they're struggling with, here's these really expensive medications that might help with the chronic disease that is obesity, but at the same time, that's a huge cost to the government.
And once you start, as we learn with certain government programs, certain legislation is hard. I cannot see with GLP-1s, with Medicare right now, people like that now ending. Yeah.
Right. So there's things like that. But ultimately, they're trying to be, I really think it's all roads lead to cost containment because they see the actuarial reports. We had just had one come out just the other day. What is the trust fund looking like? When do we exhaust those dollars? what do we do about this demographic, boom, the baby boomers, right? How do we make sure they get the care that they need and are entitled to without, having Medicare subsume the entire, gross domestic product and, every dollar flowing into Medicare and into the healthcare system. So that's what they're worried about.
Because what we've heard from AMGA members is I guess we're going to use water analogies now, because we have not even, if we're looking at the silver tsunami or the wave, we have not even gotten to the crest of the wave. We're not at the peak yet.
No, it's just starting. You can see it off on the horizon. We've been talking about this for a long time.
Right.
And have done very little about it, to be honest. But now, that wave is getting closer and closer and closer. And I think the actuaries are like, hey, they're standing on the beach saying, hey, look, gotta do something here. And Congress is like, I don't want to hear, no.
No one wants to upset their grandmothers and parents. No one wants to be the bearer of bad news of what that looks like in the future.
Right. So how do you solve that problem and shield beneficiaries from, unsustainable cost increases or, reduced access and that sort of thing? And for the past several years, the idea has been, value-based care.
Right.
This is going to be our life raft, to get us through this. And it's essentially, how can we be more efficient, right? And I can talk a lot about what CMS is doing on the fee-for-service side of things.
Right.
That's outside of Abe's, portfolio, so to speak. But inside his portfolio is like, okay, I've got this tool at CMMI. We need to have providers be as efficient as possible. How do we do that? And I think mandatory models is one of the levers, and then getting more providers into value-based arrangements voluntarily is going to have to be part of that, because they can't mandatory their way into this. By and large, I don't think they want to. They're definitely pushing mandatory models, but they know they can't do that. You can't just dragoon the entire industry along with you. You've got to get some buy-in too, and I think that's where the voluntary models come in.
So this is really interesting, because ever since the creation of CMMI, there has been a huge pushback from Republicans about this. There's been hearings even last year about, are these models scalable? What is the purpose of this? We don't like this, because they typically don't like things when the other side is doing it. But now that they're in control, I feel like the temperature around CMMI is much, much different now.
Yeah, no, I think that's exactly right. I don't like this program because you're in charge of it. And now I'm, calling the shots and get to develop the policies and implement the policies. That's a whole different feel when or environment. So all of a sudden, if your side or your team is staffing that agency or that office, totally different animal, right? So you get to imprint your policy priorities and all that. And I think that's what you're seeing now with the sort of switch from the Republican response to what's going on at CMMI.
So what else do you think that means for providers if Sutton has been sort of vocal about downside risk and mandatory models? Where do you see this being reflected now, and where do you see that kind of going in the future?
So I think, to his credit, he wants to be a partner, and I think this comes from his experience in the private sector, right? So he didn't come up through the government, so he very much appreciates that private sector background and what it takes to work in a health system and provide care and that sort of thing, and make a budget and that sort of thing. So he knows something that we've talked a lot about, and that's predictability and stability. Those were the words he actually used when he was speaking with our board of directors a few weeks ago, and I was like, my antenna definitely went up. He was like, oh, I've had that in every comment letter for the past 10 years. I wrote it. I wrote it hey, someone's actually reading what we're writing here. This is fantastic. So I think he understands more than other folks who have had that office potentially. how important that is to an organization like an AMGA member, what that means. If you're going to be responsible for the cost quality of care in some sort of value-based accountable arrangement, whatever that model looks like, the predictability and stability, I hear that from members almost every day.
Mm-hmm. So I've been at AMGA for 7 years. And so I remember when I started, there was a little dreamboat named Adam Boehler, who is at CMMI, who also had a really great relationship with AMGA. I remember he came and spoke to board members for several times.
He did.
And there seemed to be an open relationship similar to how you're describing the relationship with Abe Sutton with sort of the outside, in a way that we hadn't seen before. Like, is there a difference that you've seen between the two of them and what we're seeing now versus what we saw?
So I think
before?
the tactics are a little different, but I think the vision is similar. I think Adam Boehler and Abe Sutton definitely want to hear. I think they were sincere in wanting to hear from our members or the healthcare industry, generally, about what's working, what's not. What is it that you need to succeed? Let me partner with you. Come in and talk to us about the pain points and all that. Where they differ is, I think, Abe has the benefit of hindsight, and like what worked, what didn't, from the previous administration. And I think, going back under Boehler's term, they were throwing things against the wall to see what stayed. Like 16, 20 models were rolling out. It's like, be this one, do this one. This one requires X, Y, and Z, and this one has to do this. And it got really confusing really fast. And they were starting models and ending models. And they were really trying. It was almost like a startup mentality over there, right? Like, what is it that we're trying to accomplish here? What are we going to do? We got to get all these folks, we want 100% of Medicare in some sort of value-based arrangement by 2030. This is an impossible deadline. So they're doing, that was, what was happening when Adam Boehler was over at CMMI. Now, I think, and we push back like, hey, you can't expect our members to be in 15, 20 different models, and, there are various rules and how does one interact with the other, and it's totally confusing for everybody involved. I don't think you're seeing as many models come out, but I think one of the things he's talked about is let's be a little bit more strategic with what we're rolling out. Let's make sure everybody understands what is expected of them, and if there is an issue, we want to hear that early on in the process so we can course correct, because we really want these models to be successful. Because he's very acutely aware that CMMI's track record of taking something from the model demonstration world and actually having it be a permanent part of the program, pretty limited. I think it's like 3-4 models at best. I have to go back and look to see exactly which ones have to become a permanent part of the program. But it hasn't been, if that's your metric of success, CMMI hasn't been that successful in having them be a permanent part of the program.
Mm-hmm. So you're talking about startups. Usually under startups, it's move fast and break things.
Yeah. We
saw that kind of with the rollout of the Wiser model, right? Like, let's break some things. We're seeing that with 340B in a lot of models as well.
Yeah.
And so kind of talk a little bit more about what you're seeing there. I know from a congressional standpoint, you have members of Congress who are really like, we don't like how these models are trying to move fast and break things. And so from your experience in talking with members and from your comment letters, sort of what are the things that you've been saying as a little bit of a pushback on that?
Sure. So I think one of the things that CMMI is trying to address to the extent of their ability in the model realm is this administration's emphasis and focus on waste, fraud, and abuse, right? What can we do to clamp down on the problem spending in healthcare? And I think they understand that AMGA members are not the problem here. Unfortunately, when you're crafting a model, a regulation, a rule, it's those good actors that get caught up in this, right? Because the fraudsters are going to find, it's almost like, water is going to find the lowest point, right? They're going to find a way to navigate through the cracks in the system.
Talking about water again.
Exactly, yeah. And that is going to be, so unfortunately our members sort of get caught up in that. You see this with the Wiser model, and he was, he, to his credit, he took some licks at the board of directors meeting, and some of our members pushed back fairly fairly hard on that. But he was like, look, we consider these low value services, so we don't see why this is a problem for you, because these aren't services that are going to be beneficial to Medicare patients anyway, was sort of his response to this. Now I think he's willing to work with us, and he can fine tune how this is supposed to work a little bit. But the concept of should CMS be paying for these, I think his default is probably not. And we're going to use these tech companies to help ensure that only care that is truly needed is going to be delivered. And this is going to be a test run for how successful or not is this model going to sort of ferret out what they consider to be, low value care, because they need to get all of that, to the extent possible, out of the system if you're going to have the resources available to, fund the rest of the program for that tsunami that's coming.
So speaking of tech, it seems like there has been a little bit more focus on how do you use artificial intelligence at CMMI. Is this a genuine strategic priority, or is it a talking point? It's just something to sort of play around with?
A little bit of both. I think they're serious about it. I'm not sure they, like the rest of the country, understands how to best use this tool yet. One of the things that really struck me when he was talking about, this administration's focus on AI and then what CMS can do with it is, how do we use this to help alleviate the clinician workforce shortage? It's almost like they were waving the white flag, like, we don't have enough clinicians. We know we don't have the ability to get those clinicians in the pipeline to be trained and then placed into the field in time to address, the number of patients who need access to care. How can we use AI to help alleviate some of that shortfall? So what that looks like, totally up in the air. But that's the concept. And I know he got some pushback on that, both from our AMGA members and, I think, doctors in Congress are not going to be a fan of that. So, but I think he's willing to take some licks on that, because I think his response will be, well, what would you have me do otherwise? I understand that we have a clinician shortage. There is really little I can do in the short term to get us enough clinicians, which I don't necessarily agree with. There are things they can do. Yeah. But technology is one thing we might be able to do to essentially be like a workforce extender. Like, how can we triage with AI? How can we help support nurses with AI? How can we have clinicians be more efficient with AI? I think that's something that CMMI and this administration is very serious about, very interested in. But what that looks like, how they're going to use that, still in the framework. I guess I will have to ask Claude what it thinks, and get back to you all. But I think that is, not a solution in their opinion to the workforce shortage, but it is not the solution, but it is a solution to the workforce shortage.
So as we're wrapping up this conversation, we're in the midpoint of year 2 of his tenure. The first year, tumultuous. Now, you had Doge at the beginning of the year. A lot of people were lost their jobs. Yep. During that time. Then you had OB3 come through, massive piece of legislation. So you're seeing cuts in these government insurance programs. Yep. And so, we're at midpoint. What do you see happening? I know that there are an increase in job announcements. They're trying to bring people back. How do you see, as we're going to the midterm elections, as we're even thinking about 2028, how do you see the next 2 or maybe even 1.5 years going?
Yeah, I think they're going to want to try to get out another signature model or 2 before things start sort of wrapping up with this administration's term. And then, historically, 2-3 years seems about right for a CMMI director. I couldn't speak to what his plans are, of course, but I wouldn't be shocked to see like, okay, it's time for me to find something else to do. I think he's going to want to stick around to get the lead model. This is their new, the next model from it's replacing ACO Reach. And I think the lessons that they are implementing in lead, I expect to see more of. And this is a tenure model. And this speaks to the stability and predictability concerns that AMGA and others have raised. And he was very like, look, we heard that. This is why this is a tenure model. And we're going to do very minimal tweaks. If you have a concern with this, how this is going to roll out, come start speaking to us now so you make these tweaks and any necessary changes really before this thing gets up and running. So I wouldn't be surprised to see another longer term model that's probably focused on a condition or two, right? You've got this, this is outside of CMMI, you've got the ambulatory surgery models ramping up. So I can see them piecemeal picking conditions or procedures that they see as one of two things, either high cost or low value, and how can we create some sort of model around that to make sure that our clinicians that are providing those services are as efficient as possible, and we are spending just the right amount and not even $1 more than we would otherwise spend.
Wow. Well, it seems like a really productive conversation between Abe Sutton, AMGA board members. Yeah. So, like, any final thoughts you want to share?
I think he is legit interested in hearing from us and our members. He seems very approachable. I very much enjoyed speaking with him. And, for him to take an hour, I know it sounds silly, but he took an hour. This is a guy who's probably triple booked, every day of the week times 2, right? So I think he understands the importance of being out and speaking to, folks like AMGA board members. So if he is seriously interested in meeting with us, I think it's incumbent upon the policy team and our membership to get in there and talk to him and raise concerns. And, not only just raise concerns, but tell him like, this is what's working. They need to hear that side too. This is you guys did this right. So they need to hear that as well, so they can take those lessons and pass it on to the next team.
It looks like we're willing and able to do that.
Oh,
there we go. There we go. So it's time to wrap this up now.
It is, yeah, we're done now.
I think we hit our crest there.
Yeah, exactly.
So thanks so much for listening. It's always good to have a conversation with you about what's going on from the nerd side.
Oh, exactly. Yes. Thanks.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.